if you can get to the point where you can have true dialogue, not be worried about, offending your doctor's sensibilities or whatever. Here I will invoke an older generation. So my Scottish grandmother, bless her heart, so she was in her 90s, had a heart attack on a Sunday, so crushing chest pain, and didn't call anybody until Monday morning, and survived. And we asked why. She said, "Oh, you don't bother the doctor." and so I'll often cite that to my patients. I'm like, "You very much bother the doctor. That's what we're here for." In my group, we're fortunate we have a system where we trade off, but we cover our clinic 24/7 because we want, if you're having a heart attack, we want to know about it. And the other thing is, there's a lot we can tell about you from labs and scans. But as I mentioned earlier, you're the ultimate sort of surveillance system for your own body. And without making it too onerous on the patient, there are certain side effects I just can't see. The classic one, and this is appropriate across a variety of different tumor types, is neuropathy. So a lot of the drugs that we give in oncology, unfortunately, have a really nasty downside, which is potentially permanent nerve damage. And the problem with it is usually once it happens, it is not reversible. And so it's kind of a case where an ounce of prevention is a pound of cure. And the only way we can mitigate it often is to be extremely careful with our dosing up front. So all my patients know, like I'm on them constantly, how are your nerves this cycle? How are they now? And the reason I do that is I know that some of these drugs I just can't take back. And as I mentioned with Mayo is a world-class center for multiple myeloma, so a plasma cell disorder. And classically, the drugs that they use in multiple myeloma can cause neuropathy. So I'll never forget this. You tend to remember your mistakes more than your successes. I was in training. I was presenting to, if I'm honest, a pretty fearsome myeloma professor. He was the chair of the department. He's a very imposing man. And I suppose I was trying to placate him. Anyway, I described to him that a patient, quote, this is my exact words, only had grade 2 neuropathy. And he stopped me and he said, "You will never say that again." He said, "You'll never say only about someone's side effect." And he's absolutely right, because on this scale, grade 2 neuropathy means you have constant numbness and tingling. It's not anything that you would want. And so the other thing I guess I'll point out as a patient is the phrases that drive me the craziest in oncology are the rhetoric that tries to minimize side effects. And the phrase that I hate the most, if I'm very honest, is manageable toxicity. So often what you'll find at a scientific conference is a drug might actually work very well. It may be highly effective, but as we hinted at the very beginning, might also be extremely toxic. And so what will happen is you'll see these researchers, and understandably they're excited to share their findings, but sometimes an attempt to sugarcoat whatever this new treatment is, they'll throw that phrase in. And the reason I find it so objectionable, it's almost sophistry, is when they say that, my retort is always like, well, if it's so manageable, would you want to take this drug yourself? And it's really interesting. If you poll oncologists, and I think this has actually been done sort of formally, but you can do it informally too, and say, hey, would you be willing to take XYZ? Many people would say no. When I was at Mayo, again in myeloma, I came across this chemo recipe we were giving. And I'll be honest, Stephanie, I thought it was a misprint. It was 7 drugs put together. And I was like, there's no way. There's absolutely no way this is an accurate acronym. And sure enough, it is. It's a 7-drug regimen. And there's many of us who, if you really put our feet to the fire, would not accept the very things that we have been trained to prescribe. And that kind of, I guess I'll say it, hypocrisy has also not served us well in terms of our public image. So the goal, and I tell my patients this all the time, is to marry effectiveness to tolerability, right? And especially if you're a young person and I think you can live for decades, I want you to live for decades with a good quality of life. And that's the tough part is, sometimes to get to cure, you have to basically put the patient through just the most exquisite rigors.
Absolutely.
Like a bone marrow transplant or something. But if you can get them out the other side and they are relatively intact, that's the goal.